Today we're going to talk about calcinosis in juvenile dermatomyositis. As a definition, we have that calcinosis is the abnormal collection of calcium salts in or under the skin and in muscles or tendons, even when levels of calcium in the blood are normal. It occurs in some patients with dermatomyositis. These lesions may also appear in patients with overlapping autoimmune diseases, including systemic sclerosis, systemic lupus erythematosus, and mixed connective tissue disease.
Yvonne was a patient of mine many years ago.
I just had to keep listening to the doctor and saying, I will get there.
Maybe as exposure to the medical profession, she's chosen her own calling, being a paediatric nurse in this hospital.
I don't know, I don't actually remember the exact moment I felt okay. It was just the rashes disappeared, and there's still a bit on my elbows and knees and a bit on my eyelids, but it's something you can manage, I also got calcinosis as a side effect of it. So pretty much they resemble warts and they're on my fingers, but they don't really bother me. They're just little calcium deposits under the skin.
And we know that early treatment and aggressive treatment definitely reduces the risk of getting calcinosis, but despite very good treatment, it does happen in some children.
When I found the news out that I was in remission, it was the best thing ever. The biggest relief that the pain is going to stop. The struggle is over. It was the weight that officially lifted off my shoulders.
And she's leading a very fulfilling, productive life without any ongoing signs of weakness and without any active disease.
It doesn't affect me now. I travel, I work, I go out with friends. It's all normal. Having JDM, I didn't let that rule my life, and I didn't let that completely stop me from doing the things I wanted to do.
Sometimes they tell me they feel stronger for it. They've gone through adversity, they've come out the other end, they know they can handle anything that life's going to throw at them.
Parents that do want more information, I do recommend the Juvenile Myositis Association website, and there's a lot of support out there and their questions can be answered that way.
This disease is something we can beat. We may have some battles along the way, but we're usually going to win the war here.
The outcomes now are much better than they were even 10 years ago.
We are thrilled. We were so happy when we got the nod that we no longer have to come for our 6 monthly checkups, that it looks like we've got the all clear.
JDM does not control your life. It's not who you are. It's a small part of you, but you don't let it completely control you.
As to the applications in medical English, calcinosis appears as hard, irregular nodules or lumps in or under the skin in every area of the body. These lumps can be especially uncomfortable when they appear in the face or in joints or on pressure points such as the buttocks, the feet, or the wrists. The nodules can cause functional disability, contractures, skin ulcers, and pain. Needless to say, calcinosis can have a significantly negative impact on the patient's quality of life.
So hello friends and welcome back to my channel. Today we'll be discussing about juvenile dermatomyositis, and the reference for this is Nelson's Textbook of Pediatrics 21st edition. So JDM is basically the most common inflammatory myositis in children. It is characterized by proximal muscle weakness and a characteristic rash. The etiology is multifactorial based on genetics and environmental factors. The epidemiology: there are basically 3 cases per 1 million children per year. The peak age of onset is 4 to 10 years. In US, the girls to boys ratio is 2:1. Talking about the clinical manifestations, it is either with rash or with the insidious onset of weakness, or sometimes both. So other symptoms of JDM can be fever, dysphagia, arthritis, muscle tenderness, and fatigue. So extreme photosensitivity to UV light can also be seen, with generalized erythema in sun-exposed areas. So if these erythema is seen over chest and neck, then it is known as the shawl sign. Also, a particular heliotrope rash is also seen. So what is this rash? It is a bluish violet discoloration of eyelids. Also, facial erythema crossing the nasolabial folds can also be seen. Gotron papules. So Gotron papules are the bright pink or pale, shiny thickened or atrophic plaques over the proximal interphalangeal joints. Moving to the next, that is the mechanic hands, which can also be seen in the JDM patients. It is the thickened erythematous scaly rash over the palms. So basically here the patient's hand are seen like a mechanic. Also, difficulty climbing stairs, combing hair and getting out of the bed is seen. Gower sign. So Gower sign is use of hands on thighs to stand from a sitting position. So this is very important, which is seen clinically. Also, esophageal or respiratory muscle weakness is seen. Respiratory muscle weakness can cause respiratory failure, demonstrated by hypercarbia. The diagnosis is made by the presence of rash and at least 3 signs of muscle inflammation and weakness. Treatment include corticosteroid, which reduce morbidity, methotrexate and IV gamma globulin in severe cases, which can be given 2 gram per kg. Also should avoid sun exposure.
As to the pros and cons, as we have mentioned before, one of the other cons that calcinosis have is that if you try to remove it surgically, you can cause the immune system to cause a several reaction. So the condition, the medical condition as itself, it can turn out to be worse. As to the pros, appropriate sun protection is always important in dermatomyositis, but it may also prevent calcinosis, since sun exposure can stimulate the immune system, which may contribute to calcinosis. The issue applied in Ecuador. It is a very, but very rare disease that you don't see very often here in Ecuador, so the incidence in the population is very low.
JDM, or juvenile dermatomyositis, is an autoimmune disease which affects children.
There are some things you should know to make things easier for your family.
JDM is a rare and chronic disease, but that doesn't mean it shouldn't respond to treatment.
There is absolutely light at the end of the tunnel.
If you do what the physios and doctors tell you, life will improve.
I had JDM, I'm in remission now and I've never been more healthy.
I'm feeling better now.
JDM stands for juvenile dermatomyositis. So juvenile clearly means a child, and by definition it's children under 16. Dermatomyositis, the dermato stands for skin, like dermatologists who treat skin disease, and myositis means an inflamed muscle.
When a child develops the disease, they develop quite severe muscle weakness. Finding it difficult to do the normal tasks of being a kid, getting up in the morning, getting dressed, getting off to school. They develop quite profound weakness of their muscles, and then they start to develop usually a rash.
Generally speaking, the combination of progressive muscle weakness, particularly in the muscles around the shoulders and the hips, and skin rash is a fairly classic presentation.
As soon as we walked in, he pretty much said he thought it was JDM, and we went off and started all the tests. So it was at the age of 2 that we got our diagnosis.
And the proper treatment then would involve treating the skin disease, but more importantly, treating the inflamed muscle disease to try and get this child to regain their full strength and their full function.
But in general, we talk about, even for the milder cases, long-term treatment, usually about 3 years. That sort of treatment involves a team of professionals, so multidisciplinary care is really at the key of treatment.
As a conclusion, it is important to systematize the studies related to cases of dermatological alterations of juvenile dermatomyositis, since the disease constitutes a notable manifestation both as a marker of activity and a derived damage. Likewise, they can contribute to achieving a clear statistical perception of the morbidity rate and its consequent relationship with prognosis. Thank you very much.